had such an interesting and thought-provoking morning, I'm really looking forward to another varied afternoon's programme. I would like to remind you that this is being filmed and recorded, and it is also being live streamed, and welcome back to those of you on live stream. We are now moving to our session 4, which is the Equine Health Care Team, which will be chaired by Jonathan Statham, Chair of the Animal Health and Welfare Board of England.
Thank you very much. Good afternoon, Your Royal Highness, ladies and gentlemen. We had an excellent morning, so I'm delighted to welcome everyone back for this afternoon, where there'll be a theme of teamwork to start. And this is probably quite appropriate because after Jim's outrageous accusation about sort of poor veterinary collaboration earlier on, I'm delighted that the veterinary team and the wider equine team is going to be the solution in this afternoon's session. Please put your questions obviously in Slido as we come to the sessions, the panel questions. But I do want to say how pleased I am as Chair of Animal Health and Welfare Board and my colleague Peter Lorry here. We have a very strong relationship and working with David and Rolly and all of the team here. And it's a pleasure and a great privilege to be here to listen and to understand, and we will take away lots from today already. So I'd like to introduce our double act, and a theme I believe in very strongly. We have equine veterinary nurses in my practice. The team is a very key theme. It works very effectively, and it is probably essential for the vets that we have that support network. So I'd like to welcome Lucy Grieve, Veterinary Projects Officer at Beaver. Lucy kind of spent a chunk of time in Newmarket before actually becoming obviously President of Beaver, and now is actually Veterinary Projects Officer. We're delighted that Lucy's here in person because you spoke virtually, I think, during kind of COVID. So it's great to kind of have you here and actually do this in style. And Marie Rippingale, who is British Equine Veterinary Association kind of committee sort of nurse chair, and again as great advocate for the important role of the equine veterinary nurse. So I'd like to welcome them both to the double act. Thank you very much.
Thank you. Good afternoon, Your Royal Highness, ladies and gentlemen. In this session, Marie and I will be discussing the role of vets, nurses and allied professionals in your horse's healthcare team. I'm a vet who worked in equine practice for 15 years, as Jonathan said, and before taking up a non-clinical role at Beaver in 2022. And Marie is, well, you can introduce yourself, Marie. It's our double act. We've well rehearsed.
So I'm an equine veterinary nurse. I currently work at Bottle Green as a programme lead for an equine vet nurse qualification, and I'm chair of the Beaver Equine Nurse Committee.
So, Marie, would you like to tell us what we're doing today?
Yeah, so our session aim is to discuss the role of the following allied professionals. We've got vets, nurses, farriers, equine dental technicians, musculoskeletal therapists and saddle fitters. And we know that there's more, so please don't feel left out, but we've only got a very small amount of time. So we've just had to kind of get it down a bit. So what is the horses team? So our kind of strong belief, and just a small introduction, is that we've got the owner right in the centre there because we think that's really important. We think that the owner is the centre, they're the manager, they know their horses better than anyone else, and we'd like the owners to be able to decide which healthcare professionals they choose to use for their horse to get the best care. So we are going to spend a little bit of time talking about each one and the qualifications, and we're going to dwell a little bit on like veterinary nursing because that's an area that's changing and expanding at the moment particularly.
So I want to warn you, for the next 20 minutes, it's going to be heavy on acronyms, and I want you to shout house if you achieve a full line. So, starting with the easy ones, in my opinion at least, vets. So typically vets will train from 5 to 6 years, they'll take a bunch of exams, they'll swear an oath, and become members of the Royal College of Veterinary Surgeons. This body regulates and it also acts as a disciplinary regulator, and then you can also be struck off. So as a vet, you can do the wrong thing and be removed from that register and prevented from practicing. The legal bit refers to the acts of veterinary surgery, so we have to remember this is to protect animals from mutilation. It's a welfare thing. In order to do this, the law states that legally vets are the only people who can diagnose a condition and the only ones who can prescribe a treatment. And it's really important to remember that, as others must not be doing that. Over to Marie.
Right, so a little whistle-stop tour of the veterinary nursing qualification, because I don't think people really understand the training we go through. I think a lot of people think we pat ponies all day. We do. It's really good fun. There's a little bit more to it. It's even more fun if there's donkeys as well involved. So there's a nice job, but there's quite a lot to go with it. So the proper term for someone who's completed the necessary training is a registered veterinary nurse. We're going to call them RVNs throughout the presentation. The training course is a 2 to 3 year course, depending on which route we take, which we'll have a look at in a minute. And once we're qualified, we go on to the Royal College of Veterinary Surgeons register, and we get to say that we're an RVN. And we are basically regulated by a piece of legislation called Schedule 3 of the Veterinary Surgeons Act. So a little kind of summary of the qualifications that you can do as a veterinary nurse. So you can do a level 3 diploma, you can do that online, you can do it face-to-face, or you can do it as a hybrid now, and they often run it as an apprenticeship as well. The point of this is that you work in practice the majority of the time, and then you take time out to go to college, so maybe 1 day a week, or in block release courses in some cases. If you go on to do the degree, which is a 2 to 3 year program, you tend to take a whole year out to basically complete your online portfolio, which we're going to talk about in a minute. So there's a number of different routes you can take. The online portfolio is basically put together. It's a list of skills by the Royal College of Veterinary Surgeons. We call it the DOS. So we have to do general day one competences that will be assessed against, and then equine nurses have a specific equine list they're assessed against, and we all have to go through professional behaviours and attitudes and be judged on that by ourselves and our peers and our tutors at college as well. So it's quite a rigorous assessment on the practical side of things. So what does that mean afterwards then? So we have to complete 15 hours per year of continued professional development. We have to continually update ourselves and keep ourselves current. We must follow the RCVS Guide to Professional Conduct, so that's telling us how we should behave and what we should do. And we are accountable, so as Lucy said, actually the days of blaming the vet are absolutely gone. We can't do that anymore. So even if the vet has told us to do it, if we think it's wrong, we need to not do it. The blame cannot be shifted anymore. So we actually undergo disciplinary processes, and we can be struck off as well. So a little bit about Schedule 3. So this is the main bit of legislation that regulates veterinary nursing, tells us what we can and cannot do. I know there's a lot of text there. I'm going to summarise it very quickly. So veterinary surgeons can delegate certain acts of veterinary surgery to nurses that they employ. That's important. So certain acts of veterinary surgery, medical treatment, and carrying out minor surgery, and importantly, we're not allowed to enter body cavities. So there is a number of things we can do, but we're not allowed to enter a body cavity. Different kind of words for direction. So direction basically means that the vet can tell us to or delegate something to us, but they don't have to stay around. But if we're dealing with student veterinary nurses, they need to be supervised. And if they're carrying out minor surgery, then that supervision must be direct and continuous and personal as well. So there's just a little slide where I've just kind of summarised those terms. Direction means the vet can ask us to do something, we can accept the task, and then they can waft off and do whatever else they need to do, don't need to be there. Supervision means that a veterinary surgeon or a qualified registered veterinary nurse needs to be on the premises and able to respond to help. So if a student veterinary nurse is doing something, they must have a backup on the premises to help them if anything goes wrong. And if they're performing minor surgery, someone has to actually physically be stood next to them, giving them their complete undivided attention. So lots and lots of assessment. So BEVA recently did a lot of work on Schedule 3. We actually partnered with the BVNA, the British Veterinary Nursing Association, and the RCVS, and came up with a document explaining Schedule 3 because it's quite an outdated and difficult bit of legislation to interpret. And we came up with a list of skills that the RCVS had accepted that registered veterinary nurses could kind of carry out. So very quickly, things like administering medication is fine through the routes that are on the slide. IV catheterization, so putting a catheter into a vein, taking blood samples, acquiring images through diagnostic imaging. Now, we just need to be very clear that we are acquiring diagnostic images, but we do not diagnose the pathology. That is the role of the vet. Things within wound management, we can assess wounds, bandage them, and we can suture them as well if they're superficial. We can perform nerve blocks, but not joint blocks. Joint blocks are off limits to nurses. They're considered entering a body cavity. So nerve blocks are okay. Passing a nasogastric tube and passing an endotracheal tube, so maintaining a patent airway. We can euthanize patients if necessary, but we do believe a veterinary surgeon should be on the premises if that is occurring, and we also think that would be in an emergency situation. And we can also administer sedation and anaesthesia once that has been prescribed by the treating vet and the dose has been agreed. And we can perform second vaccinations and boosters, but we can't certify. So we can't certify the passport, so that brings up some limitations for us there. So benefits to veterinary practice, vet nurses can have more client contact, and so the patient gets a more individualised service. We can be a point of contact as well as the vets in the practice as well, so they've got more people they can talk to, and that encourages a more holistic team ethos, so everyone's getting involved with the case. We can then allow vets to go and perform tasks that they are specifically supposed to be doing, and we can get on with our tasks that we work really hard to be able to perform. And we get better job satisfaction, and so then everyone benefits, including, most importantly, the patients.
So that's the veterinary team. Now we're going to move on to farriers. So farriery is an ancient craft that dates back to the Roman Empire. And it's important to know that a blacksmith is not a farrier, although farriers do undergo blacksmithing in part of their training. They do about 3,000 hours of mental training, and during their apprenticeship of 4 years, they take exams and they become one of the following, either a diplomat, followed by associate, followed by fellow, and there are other postgraduate qualifications they can undertake. Their disciplinary body is the Farriery Registration Council, and they can prosecute farriers that either do things they shouldn't or prosecute unregistered individuals carrying out acts of farriery. And again, there's a law, where Farriers Act 1975, that describes all this. And it's to prevent suffering, it's to prevent cruelty to horses, and that's why these things have been written into law. We also have barefoot trimmers, so in recent years there's been a growing number of people trimming feet who are not farriers. The only LANTRA-approved course in the UK at this time is offered by the Equine Podiatry Association, and we have about 40 members registered in the UK at this present day. Next, we have terms for musculoskeletal therapists. So these terms here derive from the human field. Most in-depth training is undertaken by these... Oh, sorry, I haven't forwarded my slides. Thank you. Oh, sorry, I missed that slide. The most in-depth training is undertaken by these people. It's a degree-level training, and they can legally treat humans, and they are independently regulated, which is really important to remember. However, if you add a prefix to any of those terms, such as animal, veterinary, or equine, it no longer carries any sort of firm standing, as in they're not protected titles, and as such, anyone can use them. So ACPAT was an association of chartered physiotherapists in animal therapy that was created to differentiate some of these individuals from others, and those are the people who have done the human physiotherapy degree, followed by a 2-year part-time postgraduate veterinary physiotherapy degree. And they're regulated and disciplined by the Health and Care Professions Council. And again, this is independently done, which is important to recognise. Other musculoskeletal therapists, they undergo other types of voluntary, self-regulated registration. And they have varied training standards. They can apply to be listed on some of these registers, and in doing so, they have to satisfy certain criteria. But it's important to note that there is a lot of variety between the different associations, although things are changing over time, and there has been some more homogenisation of things and how they work. But as with all of these musculoskeletal therapists, it's important to recognise the vet still has to do the diagnosing and the treating, although they can go and do maintenance therapy. So, a little bit confusing, but I hope you're keeping up so far. Now we're moving on to teeth. So things get a little bit clearer with the teeth, but not that much. So it was quite complicated, but is now a slightly better organised situation than we had before. In the horse's mouth, we all heard of people that are called lay horse dentists. It's a term that's frequently used but has no meaning. So anybody in this room could be a lay dentist. And then you have an equine dental technician, and then you have the vet. And these are the 3 people that you might find doing dental work on horses. The RCVS had concerns over how this stuff was being carried out and who was being responsible and who was making sure they were doing the right things. So they created these categories in the absence of a legal exemption order. And these 3 categories were created. So the equine lay dentist can remove sharp enamel points using hand instruments only. They undergo no official training, no exams, and there's no regulatory or disciplinary body. So it's quite sobering to think that if anybody here could set up tomorrow with some hand drafts and claim to be an equine dentist. They're not allowed to use power tools, so the electric rasp that you see, and they definitely cannot remove any teeth, not even loose ones. Then you have equine dental technicians who have undergone 2 years of training, and that's supervised training, and they have to undertake some exams. They're able to do these Category 1 procedures that we've talked about, but also these Category 2 ones, which includes the using of power tools, removing loose teeth, and they can remove wolf teeth under a veterinary vet supervision. But they cannot enter the vascular or innervated tissues, which would be classed as veterinary surgery, Category 3. So, vets can do Category 3 procedures as well as all the above. And it's not to say that it's a free-for-all, because vets obviously have to abide by rules also to safeguard animal welfare. And so we're only allowed to work in our area of competence, which is why I wouldn't be removing a molar tooth despite my years in practice. So, tack fitters is our next category. We've got the Society of Master Saddlers, and they enable people to be qualified saddle fitters, and it takes about 3 to 4 years, and after another 3 to 4 years, you can be a master saddle fitter. There's also more recently a bridle fitting qualification that's come out, which takes about a year, give or take, and there's also trainees. So you will find people registered on their website that are training, and they are equally valid people to be doing your saddle fitting. Again, it's really important that these are independently assessed, so they are assessed by the city and guilds. So this is our kind of summary slide so far, which is, so when you're choosing people to be part of this team, it's important to recognise who you want. Who do you want to be there? What are they calling themselves? What name are they using? Because some of these can be unreliable indicators if you're not sure of the exact terms and what they mean. And whether they are trained, qualified and regulated. They need to be able to be removed from a register, really, if they're not doing what they should be, if they're committing sort of malpractice. And it's important also to recognise that they need insurance to carry out this work, and they won't necessarily get that insurance unless they have the right qualifications and registration. So do your due diligence, check these things and ask the questions, and as a responsible horse owner, we must be safeguarding the safety and welfare of our horses by choosing the right team, knowing that we can be confident in them and their work. So that's only really the first hurdle. We'll move on now to how you work within the team. The rest is also important. As a trained, qualified and accountable team of professionals, we have to be able to work together and readily do this. It's much easier when you're all working together legally and appropriately, because you can then have trust and integrity as part of that team. I used to dread working with people that I didn't know their background and their qualifications, because you don't know whether they're going to be doing things they shouldn't be and whether you're going to then be complicit in that work. So it's really important that we all recognise the differences between somebody that is qualified and doing what they should and somebody that isn't. When you establish your team of qualified individuals, and hopefully insured ones, then it's important to enable the flow of important information between those individuals. And as Marie's already said, the owner really is the conduit to all this. It will ensure that things aren't missed, whether that's an important treatment or a management during rehabilitation. And also subtle changes can be picked up on routine visits before a problem's even arisen. Detecting those early warning signs can really be the difference between being able to fix a problem or have it go beyond the point of return, and resulting in something like premature retirement or euthanasia at worst. Owners are in the best position to be coordinating this joint approach. And this early detection radar system is really, really valid because it does pick up on these problems before we have an issue. So we need to maximise our chances of success by working together. Next we have our case study. Marie, would you like to introduce him?
I will introduce him. So our case study is Rocky. We thought we'd just do a little case study and then break down the different roles of the healthcare team to show how we can all work together and what our different roles would be. So Rocky is 12 years old. He's lazy in the school. His owner says he's not striding out on hacks, and he's grumpy to tack up, and he also hates the mountain block. He's a good doer, lives on fresh air, currently isn't having any hard feed, and he's unshod. So there are a number of things that would ring alarm bells there. There's a whole list of them, so even one or two of them would be a worry, and really have to think about whether horses really are lazy or grumpy or hate things, and actually interpret maybe there's quite a few pain behaviours going on there. So I think we would definitely be worried about Rocky, wouldn't we?
Absolutely. So as my role as the vet, if I'm called in to see this horse, the first thing I talk about is history. And then I go on and do my clinical examination. And by this point, I'm starting to build a picture of all the jigsaw puzzles about what might be going on. And obviously, first in my head with this sort of scenario is this horse got some sort of laminitis thing going on or hyperinsulinemia, because he's a bit on the podgy side. I'll then think about what tests I need to do, and then whether I'm going to be able to make a diagnosis based on that information I've got in order to create my treatment plan and then give some nutritional management advice as well.
So role of the vet nurse. So my role within this case would be to lots of communication with the owner. I can go off and take a history and perform a clinical exam. Having spoken to Lucy, she sent me off to go and do that, and then I can report back to her. And things that I can be delegated to go off and do on my own. So I could go and blood sample Rocky, I could perform radiography, and again, I'm just acquiring the images and not diagnosing any conditions. I would be able to be sent out on an ambulatory basis to go and reassess Rocky if Lucy wanted me to, and go and have a chat to the owner about how we're getting on. I would always report everything back to Lucy or the vet in charge, and I could also help with nutritional management. And there is a massive role here on an ambulatory basis for nurses to go out and help owners with all these things, whilst also helping them implement all the management strategies that Lucy's discussed with them, because I think we give them this massive long list of stuff to do, and it's overwhelming for them. So actually we can send nurses out now to assist with that, as well as performing some of the Schedule 3 procedures as well.
And I think it's really important to recognise that repetition of communication is really valid. So every time I went out, or every time Marie would go out, we could keep drumming home those same points. And that's really important, I think, when dealing with particularly clients who are in distress with a horse or are worried about the horse's welfare. Next, we've got the role of the farrier. So meanwhile, I'll be getting onto the blower to the farrier, asking him a few questions with the owner's permission, obviously, that I can't contact their farrier. And I'd be saying, you know, you've seen this horse every 6 weeks or so, hopefully not the sort of longer credit crunch, 10 to 12 weeks. And he's now got his work cut out for him, this farrier. He's going to have to carry out all that remedial farriery. He's going to have to consider the impact on the welfare of this horse, because his work is probably even more important than mine in this scenario, because he can really make a big difference to the horse's comfort very, very quickly with his skills, whereas I have basically got to rely on Bute alone. And then with my x-rays that I'm using, I'll be sharing those with him. I'll be sending them on WhatsApp or asking him to pop into the practice so we can talk about them, because he's going to need those x-rays just as much as I am for his ongoing treatment plan from a farriery point of view. And also he'll be the one saying to me, I need some more x-rays doing. You know, he's better, but I'm still not happy. Can we get some more x-rays done? So it's a two-way process there between farrier and vet. And obviously, as Marie's alluded to, I'm going to be swanning around doing my own thing. So I'll just send Marie out to do the x-rays, because by this point, I'm a bit bored of heavy lifting all that equipment.
Rude.
So over to Marie, who can then also go back out at the time of x-ray and perform another clinical exam and do another reassessment. So this is not time wasted at all.
That's right, I get to drink tea with the owner, so she's missing out, it's fine.
And she gets cake, and I
do get cake, yes, I need to work hard for the cake. Sorry, role of the musculoskeletal therapist. We're going to get distracted at some point. Yeah. So they're really good. So we're going to get them at this point. They've got a long-term history, probably been seeing Rocky for a while anyway because of his problems. They will have had those periodic examinations, and they'll be able to detect those subtle changes over time. So what we'd like them to do is kind of maintain a range of motion for Rocky. And really important, if he ends up on box rest for a long period of time, is this physical stimulation and the mental stimulation. There's no reason why you can't do carrot stretches and some kind of mobility in the box. And just keeping him mentally ticking over as well so that he's happy. And again, and they'll come back and they'll reassess him as well. And I think we don't use the physiotherapy as much in the patients on box rest as we do in athletic performance. And it's a really valuable part. If he's been holding himself in one way, or if you've got your laminitic stance, they get really stiff and sore. So very, very important part of the treatment plan.
Yeah, absolutely. And I think this is where you really start to recognise that the team is not always that obvious. And I think the importance of all the members really does come together. Because next we've, you know, just as we were finishing up with our obvious ones, we've got the saddle fitter. You know, we're roping everyone into this case here. The value to every member is involvement in that persists through all the parties. We have an increasing evidence from research that, whose thunder I won't steal because they're going to release this research quite soon, but there's evidence that the most subtle of problems can create changes in the horse's body, which can be detected by saddle fitters when they're measuring these horses up. And that can even help us direct diagnosis, management, treatment, and whether our treatments are working. A saddle fitter will be sort of assessing a horse every 3, 6, 9, 12 months, depending on the requirements. And so they're garnering all that information every time, and they're recording it as well, these qualified saddle fitters. So it's amazing what picture you can build up with all the information that's available from all these people. And every trained and qualified professional who sees the horse can bring with them that expertise, whether it's an extra pair of hands or eyes, experience. It's all that time that's well spent and benefiting your horse. So the EDT, sorry, I thought that was you then. The EDT, so just when we thought they'd got away with it, they're coming involved as well, because I'm going to put this horse on loads of straw to eat, and if its teeth aren't okay, then the straw might not get chewed up properly. So we're not going to miss out them in this whole process. So I'm aware that some of you might think this all sounds a bit like overkill, but believe me, in light of what we know, that's not how these things work. If any of you think that we can avoid or fix our horses' problems on our own without each other, we're setting ourselves up for failure. We have significant evidence now for these important factors and maintaining good welfare, and never mind the performance issues and how we can improve their performance through this teamwork. But cutting corners and letting egos rule is only doing a disservice to our equine partners and athletes.
So as a team, we can treat the horse, and we're not just looking at the isolated condition or the ailment, but we're kind of looking to the future. So we want a holistic approach for Rocky, not just for now, but for later on. And in doing so, we can help with prevention of issues and put in place plans to avoid illness and injury where possible. And that's going to be better for the animal. It's going to be better for the owner financially as well. And what we want is the best for Rocky, but we do that as a holistic approach and working with the owner.
Great.
That was just a blatant excuse to put a picture of my donkeys on the slide.
She got the donkeys in.
Very pleased.
Thank you.
So just while we're taking seats, I just want to say, again, a great thank you. I think that was superb. And I think, Rocky as a case study really illustrates, I think, the importance of working together and what we can all learn in that way. So thank you. It was really excellent. Again, we've got some questions on Slido, but I'm going to just invite, first of all, whether there's any questions from the floor. And just a reminder, please do stand if you can say your name, if you could, as you go. But question just over there, if that's okay first. Thank you.
Caroline Lindsay, horsesaddlerider.com. There seems to be no redress for rider trainers, coaches, instructors who are free to coerce horses to perform, potentially disregarding pain signs and causing more injury than the regulated carers. Do you think they should also form part of the horse's welfare team for scrutiny? So I've seen quite a bit of harm done by trainers.
Thank you. Shall I pass that to you first, Lucy, if that's okay?
Yeah, and I think you're absolutely right. I think that demonstrates perfectly well how everybody is part of the team. And I know we went through sort of a small number of the allied professionals there, but absolutely the trainer, the instructor, the yard manager, anyone involved in the horse has got a role and a responsibility. And the training, as we know from latest research, can be really detrimental to horses, and getting it wrong can have severe consequences. So I think they've played a massive part in making sure that they're not doing that. How we go about trying to regulate that is a different matter, and I don't think I have the answer.
Thank you, Lucy. We've got absolutely loads of questions. So I'm going to try and get kind of a few of these if we can. So I think there was Joe at the front, actually, if that was okay, and then I will pick up some from Slido as well. So forgive me, we won't be able to get to everybody, but I'm going to try and get through as many as we can. So
my name is Joe Collins. I'm the Chief Veterinary Advisor at the Donkey Sanctuary, and not responsible for teaching Jonathan everything he knows about donkeys when I was at Cambridge Vet School. I find it very interesting, Lucy, that you didn't put the veterinarian at the centre of that slide, because I think that many of our profession would feel that the veterinary profession and the vet should be at the centre of that slide. That's not my personal view, so I'm being a devil's advocate here, but I'm very interested that you didn't do so. The vets and vet nurses, of course, work very closely together, and veterinary nurses are invariably employed in veterinary practices. But the other persons that you mentioned as part of this team generally aren't. So the coordination with those must be often much more difficult. And out in the real world, it's nothing like as rosy as it might sometimes be. Would you like to comment?
If I go to Lucy, but can I come to Marie as well on this one? Because I think, but Lucy first, but I do want to bring Marie into it.
Yeah, I think you raise a good point there. And certainly we talked about the vet-led team in the sort of more recent years. I think that the problem being it's quite unrealistic to expect a vet to be the team manager of every horse they see. I just don't think we have the capacity in our days, and I'm guilty of it with some of my clients in the past. I'd be letting them sort of pour everything about their horse onto me via WhatsApp. I wasn't getting to bed or going to sleep or seeing my family or doing anything but reading WhatsApp messages. So I don't think it's achievable unless you're in a very niche situation where you've got a very few number of clients. But I think the owner ultimately has to take that responsibility, and they are the best placed person to do it. They have that communication. What's important is the communication goes in different directions at the right times, and that allowing and that sort of advocating for that communication to happen from the owner is what's important.
Thanks, Lucy. Can I just ask, Marie, your thoughts on this as well?
Yeah, so I would say the same as Lucy, but also, making that vet the centre of that team, it puts a lot of pressure on you as well. And I think we've been seeing with the problem of vets not wanting to delegate to nurses is all that, it's all on me and it's all my responsibility. So I think actually putting the owner at the centre and putting the responsibility on them to then go out and find these medical professionals to treat is a positive thing as well.
Yeah.
Thank you. I'm just going to pick one related one off Slido, and then I'm going to go back, obviously, to your questions, because there's a few hands before. So there's a question here on Slido which says, so the BHC manifesto, which we heard obviously very positively about earlier, highlights the challenge of veterinary capacity in the equine sector. So can I just ask you which initiatives you think we should prioritise? Because you've described quite a few. So which ones do you think we should prioritise? I don't know whether, Marie, you want to pick that one up first.
Well, I think the trouble is it's really hard to pick, isn't it? Because you can focus on one thing and then you can miss the bigger picture and miss the greater impact you might have there. So for me, just welfare in general, trying to improve things for the horse on a day-to-day basis and for its lifetime. Anything that impacts that to me is of value. I don't know, Marie?
Yeah, no, I'd definitely go for the welfare, yeah.
So, excellent.
I think it's agreement there.
That's a bit of a, get out. But
That sounds good. Excellent, it's good. Can I ask us any more from, I think there's a question over there from the audience, if we can. Thank you.
Hello, I'm Jo Paul. I'm the president of the Register of Animal Musculoskeletal Practitioners, or RAMP, so thank you for putting us up there. You were quite right to say that the human qualified people are statutory regulated, and the physiotherapists particularly with the HCPC. Can I just clarify that RAMP is trying to be a register for the veterinary industry in the same sort of way, and we are a voluntary industry regulator. So with that clarification, would it be more likely that more vets would refer to people that they knew were voluntary regulated and regulated to the standard of degree entry, and they had their insurance and they did their CPD, etc.? That's my question, really. Do you think it's a valuable thing to vets we haven't reached yet, and should we keep going?
as in, do you feel like vets should keep working in that direction with RAMP? Is that what you're saying? Sorry, I misunderstood the question.
Yeah, well, yes, some work with us, but others haven't heard of us yet. And you had a plethora of professional associations up there. So there was IRVAP and ACPAT and everybody else. And I think it's a very confusing marketplace.
Yes.
So what we're trying to do is the due diligence and make sure that people actually are qualified to do what they're going to do. So whether you want to use a chiropractic, an osteopath or a physiotherapist, they will be qualified to the same level as in human care. And so with that knowledge, are vets more likely to work more closely with MSK practitioners?
Yeah, and I think what's important to recognise is that everybody's got their kind of place if they've undergone some degree of training and qualification, and it's knowing what the limits are for that person, because it comes with experience as well, doesn't it? Somebody that's just qualified may be less able to do certain things than someone that's had years of qualification regardless. So I think we're comparing apples and pears sometimes when we try and broad brush these kind of things. So what we have to do as individuals is educate, particularly with the owners, help them understand the system and the choices, and then work with them. What does this horse need, really, is the question, isn't it? Not which person should do it. It's in the local environment. It's what does the horse need, and can we find the right person to do that for the horse? That's my...
Can I just pick another off Slido? And I think I'll probably bring Marie in on this one if we can. So I think I was really interested in the role of the support, so as well as the kind of the picking the problem up, but actually the clinical case management side, the role for the VN. So there's a question on Slido which asks, do you believe that the level of nutritional training that's provided to vets and vet nurses is sufficient, and is CPD easily available in the nutrition sort of sector?
Yeah, so for our nursing qualification, we actually spend a long time, there's a whole unit section on nutrition, which they get assessed on with a written exam, and they get assessed on practically as well. But what we were always encouraged to do in practice was to assist the owner to a certain extent, and then if you need more specialist help, we'd get the feed companies involved and just work with them as well. So there's that element of it as well, where we work with the nutritionalists, with the feed companies. But we do have a fair base knowledge to go on to start with. I don't know what it's like in the vet degree.
Yeah, I mean, there's a lot to squeeze into a vet degree, that's the problem. But actually, people that are interested in nutrition and do the CPD and read up and stay on top of it, because it's quite a fast-moving area, I think you get good vets who do these things and know it well, and good nurses. I mean, I always used to phone the nurses when I needed nutrition advice for my patients, because they would be more up to date with it. I couldn't keep abreast of it all, but
I like a bit of nutrition.
Can I just ask if we've got time for one more? Is that perfect? So, is there another one in the? I think there's just back there actually. If it just so that's right along that row. Just pass along to the middle, please. Thank you. Yes, sir.
Hi, I'm Gemma from Sparshot College. Just curious, is it easier or harder as a vet and a nurse to put a horse to sleep with euthanasia, or does it become harder, or do you get desensitized? I just wondered from your experience, what's that like?
So just euthanasia, yeah, as a process. Yeah, I mean, I don't think you get desensitized. I think you get used to doing it and knowing how you can do it best for the owner and the animal. And there's a practical side, and then there's the emotional support side. So there's two different prongs to that. There's definitely euthanasias that I still think about. So I don't think you do get over it, but you're never doing it for fun, are you? You're doing it because there's an indication at the end of the day. This is a required process that horse has to undergo, sadly, for whatever reason. But I see it as a positive thing that we can offer to them as patients. So it's a sort of tricky one, isn't it? That's how I view it.
You have to see it as a welfare thing, don't you? It's like that is sometimes just the last privilege of letting that animal go in a with dignity, isn't it? So although mentally it's never easy, you know why you're doing it for the right reasons, and if you've spent a lot of time with that owner and you know that patient really well, that is that final privilege and that final act that you can perform for them, but it's never easy.
I think maybe it's another really great example of teamwork in terms of that ongoing care for owner as well as patient, in terms of bringing those two things together. So, well, I think very sadly, I think we're actually out of time. We've still got loads of questions, but I'm sure that they're available to talk to later. And I think it's been absolutely fantastic. So, could we give them a round of applause again?
Thank you.
Superb.